Live, where news comes first. This is ABC-7 Xtra.
Good evening. I'm Maria Garcia. Thank you so much for joining us on this Easter Sunday. Texas lawmakers are right now discussing the massive state budget, and you would think that maybe education or transportation would dominate the conversation. But in Texas politics, often social issues create the most waves, and we saw that this week with one tiny budget amendment that is creating a big controversy. Republican State Representative Stuart Spitzer this week introduced an amendment to the state's budget that would defund HIV prevention programs, and instead that money would go toward abstinence education. The money would be about $3 million. Things got unusually personal. Representative Spitzer, also a doctor, said he had practiced abstinence until marriage and that children could follow his example. He said, quote, "I've had sex with one woman in my life, and that is my wife." And joining us now is Veronica Garcia with the Border AIDS Partnership. Welcome.
Thanks, Maria.
Thanks for coming. We do want to say we invited the local Republican Party here in El Paso, plus groups that promote abstinence education, and also some religious organizations that actually teach abstinence, but no one agreed to come. So, Veronica, we'll get right to the discussion with you. We still have plenty to talk about. You know, the measure has a long way for final approval. It still has to survive the budget sessions with the Senate, but the Senate is also heavily dominated by conservatives. So, you know, it's likely that this might become a reality.
Definitely a point of concern. And one of the first things that I'll address is the fact that given the importance of this public health issue, anytime that you have an important public health issue, you have innovators that come out to kind of create the programming to address the issues. You've got a lot of innovative programming in this field, specifically HIV, AIDS, education, and prevention work. So
organizations, you mean, who are leading the way in research or in HIV prevention?
Definitely. All kinds of organizations at all levels. We're talking about organizations that are conducting research at the academic level, at the institutional level. We're talking about community-based groups and organizations that are literally street level, kind of working with people and trying to do direct face-to-face prevention and education work. So you've got all kinds of innovation. But when you've got so much innovation and a very minimal pool of resources to actually deploy that innovation, one of the biggest standards that groups working on these issues have to meet is literally that they have to apply evidence-based strategies to the work that they do. When we're talking about abstinence-only education, we know from many years of research, very academic-based, stringent research, that abstinence-only strategies do not work and have not shown to have a significant impact on the sexual behaviors of teenagers.
What about, and I have to say, what about parents watching who says abstinence from sex is the only form of pregnancy or STD prevention that is 100% effective, that every method of contraception has a risk of failure no matter how small or how big it is, but a teen who practices abstinence won't become pregnant or won't get an STD?
Yes, now what we're talking about is we're assuming that simply because we've utilized a curriculum that we believe has taught such teenager to make the decision to remain abstinent, that they are in fact remaining abstinent. And what research shows, again, studies that demonstrate that these abstinence-only curricula are not successful, demonstrates that regardless of what teens are actually reporting about their own individual experiences and sexual practices and behaviors, the data is showing that that's not necessarily what's happening. It's not necessarily reflective of the trends. So we can say that, we can assume that because we teach our children abstinence-only programs, that they are practicing kind of abstinence-only behaviors, oriented behaviors, right? But that doesn't necessarily flesh out when we look at the numbers. And again, that's why we go back to the fact that so many of these curricula have actually been researched. They've been evaluated at the federal level and at the state level. Texas A&M actually they did a review of some of the curricula that were being utilized in the state of Texas back in 2004, and this is just at the state level. And at that point, one of the researchers assessing these abstinence-only programs and their effectiveness said that these programs actually seem more concerned with politics than the health and safety and well-being of our children.
And speaking of politics, I mean, as long as this is tied to public funding, the issue is going to be politicized. As long as politicians are the ones controlling this money, it's going to be politicized. And so there are people who are going to say, regardless of what the research says, Texas voters in the last election heavily voted Republican. And so they gave the stamp of approval for Republican values, and among the Republican values is abstinence.
Right, so how do we address that? So let me say, so Representative Spitzer says that his end goal is to have a state, Texas, that is free of the impact of HIV and AIDS, right? So this is a very political issue. He says that's his end goal. However, we can look at a current case kind of taking place in Scott County, Indiana right now. And we're looking at the fact that there's actually an outbreak of new HIV infections in Scott County, Indiana. And the reason, they're attributing the cause of that increase in outbreak to intravenous drug users. So we can say that Representative Spitzer's end goal is to have a state that's free of the impact of HIV and AIDS. But if we don't really address the issues that are predominantly driving today current trends of new infections, one of those, for example, being intravenous drug use, then no matter how much we talk about abstinence-only programming, whether it's actually successful or it has a proven track record or not, the reality is that really our top priority if we're talking about eliminating the impact of HIV and AIDS infections on the state of Texas?
So you're saying as long as this issue is politicized and we're using emotion instead of research, then we're never going to get to the bottom of the problem.
Exactly.
Now, I want to talk about some of the other points that abstinence advocates use. They say teens who practice abstinence are much less likely, they say, to experience a physically or emotionally abusive relationship, drop out of high school, or engaged in substance abuse. What do you think about that?
Now, I can't necessarily speak specifically to those numbers. I'm not aware of any of the data or the research that actually backs up those assertions. What I can tell you is that currently, Texas has the third highest rate of new HIV/AIDS infections. We also have the fifth highest rate in states across the country in teenage pregnancy cases.
Right.
So, you know, show me the numbers, show me the data, and let's have a real conversation about what's really working. We started off this conversation talking about evidence-based strategies. There's nothing about abstinence-only education for teens that shows, and this has been demonstrated, again, both at the state level and the federal level, of evaluations that have taken place on these different programmings. They've demonstrated that they have no positive impact either on decreasing teen pregnancy rates or decreasing rates of new HIV/AIDS infections among teens.
Speaking of the numbers, tell me about HIV infections in El Paso. Where do we stand with that?
This is another important issue that we need to consider when we're addressing this issue, Maria. Now, when you look at the rates of new HIV/AIDS infections here locally, we're talking about El Paso County. Over the last 3 years, from 2010 to 2013, we actually saw a stabilizing of new cases of infection, diagnosed infections here locally. Contrast that with this funding initiative that's going to be looking at diverting up to $3 million away from prevention and education strategies to focus on these unfounded abstinence-only strategies. And therein you have a very, very, very concerning conflict, because we've managed to actually stabilize the rates of new infections, and at the same time, we still see a lot of disparities in terms of where those cases are falling, which types of communities are more disparately being impacted by new infections. And really consistently what we're seeing currently is that it's not necessarily teens that are engaging in or contemplating heterosexual sexual behavior. So that's not our priority if what we're really looking to do is decrease the rates of new HIV/AIDS infections. Here in El Paso, when you can say that over the course of the last 3 years, we've actually managed to bring rates to we've managed to level off new cases of diagnosed infections. And so what type of impact is this kind of diversion in funding over the next 2 years going to have on what we've been able to accomplish to date?
So if it's not teens right now who are the most at risk, what age groups are?
I couldn't give you specific up to the date current age brackets, but what I can point you to is some of the other modes of infection that we're currently having to look at, that where we're really seeing the highest rates of new diagnosed infections. And again, I already mentioned that one of the ways that we're seeing an increase in newly diagnosed infections is through intravenous drug use. That's a major issue right now, and is a big driver behind currently increasing rates of new HIV and AIDS infections. So why aren't we addressing that? Why didn't Representative Spitzer decide to address the issue of, for example, needle exchange programs? That's a contentious policy issue right now. But that type of initiative has actually demonstrated success in various states around the country. Something as simple as addressing the fact that there are intravenous drug users in our communities. And so we need to figure out how we're going to define the strategies that actually address the real issues that our communities are faced with.
Okay, all right. We have to take a break. When we come back, we're going to have reaction from some of our viewers, so stay with us. You're watching ABC-7 Extra, where news comes first. Welcome back to ABC-7 Extra. I'm Maria Garcia. Glad you're with us. We're talking to Veronica Garcia today with the Border AIDS Partnership. Thank you for joining us. Let's go to our viewer comments. This is Mary. She writes, we voted Republican for a reason. HIV prevention may be good, but abstinence is more important. It's the only foolproof way to keep our children free of disease. What do you say to Mary, Veronica?
Well, again, that's a tough issue, because what we're doing is we're assuming that simply because we decide that we want to focus on abstinence-only education, that those lessons are actually permeating to teenagers, and that's actually translating into their sexual behaviors and practices, or lack thereof. And that's a huge leap to make. You're almost creating an equation where you're saying 1 + 1 = 3. It's not really based in any sort of practical reality. And again, we've seen that through evaluations of these types of programming that actually says over and over again, and actually some of these evaluations actually show that abstinence-only programs can actually be detrimental to sexual health of teenagers. And some of that we see kind of coming to the surface in that when you don't actually educate young people by providing them the facts, the real facts, and then offer them an opportunity to make the right choices, you're not actually preparing them for that time when choice comes. A lot of these evaluations of some of the abstinence-only curricula have also demonstrated that some of their major shortcomings lie in the fact that there isn't any support built into these programs for after the fact. So you have these groups that come in and they provide their abstinence-only training for, let's say, a group of teenagers. And then they come in and they leave, and they've provided the training. And again, we're going to just assume that this training has landed and youth will actually apply the training to their everyday lived experiences.
And that they won't have sex.
And that they won't have sex. And even if we want to believe, let's just say, right, just for the sake of this argument, that it's true, that 100% of the teens that go through that abstinence-only training will choose
not engage
to try to be abstinent.
Right.
However, after these programs come in and actually deliver this one-time curriculum, a lot of these programs don't actually provide any sort of follow-up support. So it doesn't take into account that once that teen leaves your 1 or 2 hour training on abstinence only, they're going to have so many other influences. They're going to be bombarded by social influence, peer pressure, media influences, all of these other influences that we know impact the way that youth practice decision making. And so these programs don't provide any sort of follow-up or foundation to really actually support these teens in making these abstinence-only decisions.
Truly sex is everywhere. I mean, network television, like you watch just a regular network television show, and it's just a normal part of life. If you're just a normal everyday American living your life, you're going to see images and messages, whether you're a teenager or not, that influence, I think, your sexual behavior.
Absolutely.
Yeah, so let's go to another comment from one of our viewers, if we can take that here. This is from Larry. I'm tired of men, politicians making decisions for our daughters, sisters, mothers. We need education, not abstinence. So again, Larry referring to the fact that this is an issue that is politicized. Tell me, you know, for organizations that are trying to do HIV research, how are you hindered by the fact that this is a topic that is so muddled politically?
You know, one of the biggest hindrances comes in the fact that we allocate so many resources to just engaging the debate. Is this or is this not a real issue impacting real people in our community? Versus utilizing all that capacity to address the fact that, yes, the numbers show this is a real issue for our community. You know, really consistently on both sides of the issues, what we hear, the rhetoric that we hear people coming forth with, because you do acknowledge that this is a very political issue just by nature, by its nature. But the arguments that you hear coming from both sides, both ends of that spectrum, really tend to put abstinence education in direct contrast with HIV/AIDS education and prevention work. And those two strategies are not inherently in conflict. It's actually possible. And in fact, some of the most successful curricula have demonstrated success with hybrid models that include abstinence education, but also provide education to address decision making that maybe diverts from choices of abstinence.
So you're saying state lawmakers shouldn't focus on one or the other, that it has to be one or the other?
Yes.
That often successful programs incorporate both philosophies.
Yes. And that's where we get stuck, Maria. Like you acknowledged, again, this is by nature a very political issue. But at the end of the day, what's going to be the most helpful to youth in our community who are being faced with the tough decisions of being a teenager all day, every day, all of the tough decisions that come with that territory. The best thing that we can do for our youth is to educate them and then provide the support to help them make the healthiest possible decisions. But you're doing a great disservice to our youth when you don't even start from a place of providing the education to make the healthy decisions. And that's evidenced again by looking at the numbers. Again, we have the third highest rate of newly diagnosed HIV/AIDS infections of any state in the country, and we continue to have among the highest rates of new teen pregnancy cases. And that's not changing. These dynamics are not changing across the years when you look at just local data. So we need to address that. We need to really look at the hard data. We need to look at what's really happening. When we start to look at the research, we're able to begin to pull away some of that emotion and really begin to look at strategically what needs to happen to create the safer communities that we all want for our children.
You know, and unfortunately that often doesn't happen in politics. Emotion sometimes comes first rather than data. But I want to talk about this. Somebody wrote in, teens are at a stage in life in which they're already emotionally vulnerable. Getting involved in a sexual relationship increases that vulnerability and the chances of being hurt or used by a partner. By abstaining from sex, it's a lot easier to figure out if a relationship or a person is good for you. What are your thoughts on that?
Okay, however, let's look at the numbers that show that youth are not abstaining from sex. Simply because they receive the training and sit through an hour-long, 2-hour-long presentation on the benefits of abstinence does not necessarily translate to the behaviors that they will engage in once they walk out of that 1-hour, 2-hour-long training. So would abstinence be our preference for young people? Okay, yeah, and I can say personally, yeah, I think that that's probably a good idea, right, for all of the reasons that you just addressed. However, that's not the path that youth are necessarily taking. And so we have to prepare them. We have to educate them to make the choices that they're going to make.
There's always an ideal and then there's a reality, right?
Exactly. That's exactly what I'm trying to say.
Okay, so let's take another one of our viewers. Abstinence doesn't work. Why are we politicizing the issue? Texas has a high teen birth rate. If we care about our children, we'll give them the tools to be safe rather than teach abstinence. And that is from Jennifer on Facebook. Thank you, Jennifer, for your comments. So Jennifer agrees with you there.
But if I could point out,
Go ahead.
you still see some of the kind of posing the issue as this inherent conflict between abstinence education and, safe sex education, other alternative strategies. You still see these different strategies being paired in direct conflict with one another. And that's not necessarily the most effective and productive conversation to have either.
Right. So they don't necessarily have to be pit against each other.
That's it.
Yeah. Somebody wrote in, abstinence costs nothing, and there are no side effects as there are with oral contraceptives and many other forms of pregnancy prevention.
I would say that our false belief in the fact that abstinence is a practiced reality is dangerous. It's dangerous to keep believing what we want to believe versus acknowledging the facts of the matter here.
Okay, when we come back, we're going to talk a little bit about some of the HIV prevention efforts here in El Paso, so stay with us. You're watching ABC-7 Extra. We'll be right back. Welcome back. I'm Maria Garcia. Glad you're with us today. We're talking about the amendment in the state budget going through the Texas legislature right now that passed in the Texas House that would defund HIV prevention programs in favor of funding abstinence education. And joining us is Veronica Garcia with the Border AIDS Partnership. Thank you. It's been a really enlightening conversation. So Veronica, $3 million statewide. Tell me, what kind of impact does that have in El Paso?
Well, one of the biggest things that we need to look at, Maria, is, I've already addressed the fact that over the course of the last about 3 years or so, we've actually seen a stabilizing of new cases of diagnosed HIV/AIDS infections here in El Paso. And that's, for a lot of reasons, that's something to be very, very proud of. Ideally, we want to continue to bring those rates down, at minimum, at least continue to keep them at the same levels.
And what are those levels? You say they're stabilized, but what are those levels? What are those numbers?
Over the last 3 years, we'd be looking at a rate of about, an estimate of about 14 people diagnosed with new HIV/AIDS infections out of every 100,000 people. Okay. So that rate actually still places us very highly when you're looking at national rates and rates across other states in the country. But at least for our local region, that's an improvement over historic rates of infections, higher historic rates of infection.
And what about the reporting? I mean, those are cases that are being reported. Do you think there's a significant amount of cases that are not being reported?
Absolutely, absolutely. And that's one of the biggest things that we find when we focus resources on really going after testing, promoting testing and education services, HIV/AIDS education and testing services. So anytime that you have an individual that's in our community and actively participating in our community that may not know that they actually are HIV positive, that individual is actually putting themselves and the community at increased risk. But without actual knowledge that they may be carrying the infection, there's really nothing we can do to actually implement preventative strategies. But when you actually emphasize promoting resources to provide testing, that's one of the first steps that a community has to take to begin to even actually kind of get a real sense of the real scope of the problem. But yes, I mean, by all means, you hear about conversations happening all across the country. That's one of the biggest points that we need to emphasize. We absolutely cannot divert resources from testing initiatives. So first and foremost, those are some of the most important initiatives to truly identifying the issue at hand.
And so when people hear HIV prevention, HIV education, what does this translate to? What does that mean? What are some of the programs, for example, that the Border AIDS Partnership, I mean, I know you're a funding entity, but that other organizations perhaps are doing in terms of HIV education?
Sure. One of the things that I want to point out, Maria, is that, like we've already said over and over again, this issue is a highly politicized issue. There's also a lot of stigma and a lot of erroneous stereotypes that are associated with the issue of HIV/AIDS prevention and education. And one of the biggest stereotypes is that HIV/AIDS education and prevention initiatives are programs for the gay, lesbian, bisexual, transgender, and queer community, and that's really where our focus needs to be. The reality here locally for us and the Border AIDS Partnership specifically is that the programs that we primarily are funding to promote HIV/AIDS prevention and education programming are not necessarily focused on addressing simply the LGBTQ community. One of our longest standing programs is actually a youth program through University Hospital, and they work with local youth to use a train the trainer curriculum. They train local teens to actually go out into the schools and really kind of spread out, deliver that education to their peers. And that's a strategy that, again, is evidence-based. It has been demonstrated to turn out positive results when you empower teens with information and prepare them to go out and relay that information to their peers.
And if somebody wants to get involved or wants more information on the Border AIDS Partnership, where do they go?
You can find us online. I'd encourage everybody to visit our website. We're at www.borderaids.org. We have a Facebook page as well. Look for us again at Border AIDS Partnership. And through those resources, we can get you connected with the work that we're specifically doing as a funding entity. And we can also get you connected with any of the number of organizations that we support also in doing kind of ground level education and prevention work.
Okay, Veronica, thank you so much for joining us. It's been really great to talk
Maria.
with you.
Pleasure to
Thank
meet
you so much. Thank you. And thank you so much for joining us on ABC-7 Extra. We hope you found this enlightening and informative, and we'll see you next week. Bye-bye.